Alright, so we're opening the phone lines for you guys to call up and ask our doctor in the studio today. 2282-9062, 2282-3043. We're talking about appendicitis today.
That's right, open doc segment.
Yeah, section segment. Thank you so much for joining us, Dr. Zamzuri Zakaria, General Surgeon, Breast and Endocrine Hospital, Putrajaya. Now, we've had a lot of myths and theories about appendicitis, but what actually constitutes appendicitis?
Well, basically, appendicitis means inflammation of the appendix. Everybody have appendix, and it is situated at the right lower abdomen, on the right side and lower, this side. So what happens when you have inflammation of the appendix, then you start to have the pain and all those symptoms that that you might heard from your friends. They have abdominal pain, sometimes they feel like indigestion, and then their appetite is not that good, they start vomiting, sometimes they look very sick, and you don't want to look very sick until you are diagnosed to have appendicitis. You want to come early to see a doctor, because if you've been seen by a doctor at a very, very late stage, sometimes it end up in a very, very bad situation.
So it's appendectomy.
Yeah, then if you are diagnosed with appendicitis, then you need to go for an operation. So the management is operation.
Okay, but there's no cure for it? Other than removing it?
Yes, there's no cure for it other than removing it. But in a very, very special condition, if let's say you have a very, very old, fragile lady that cannot go for an operation, I mean the risk is very high. Let's say she have a lot of medical problems like heart disease, she had just had a stroke, and so on.
Diabetes.
If it is diabetes, a lot of medical condition, if she's let's say she's a high risk for an operation. If the appendicitis is diagnosed at an early stage, then we can try and treat her with antibiotics. However, if let's say when she been admitted, we always monitor this patient. If her condition worsen, then she still have to go for an operation.
I see. Now, early stage, are you talking about going to check the appendix even without feeling the pain yet?
Right. The thing is like this, at the early stage of appendicitis, right, the symptom can be very vague. Sometimes patient can describe it as indigestion. It's just like, oh, I'm having this gastritis, right? Then after a while, the patient might go to, when they have the symptoms, after a while they might go and see a GP or any doctor which is close to their home. And they might be diagnosed with gastritis. Then they go home, take this medicine that we prescribe. Then after a while, normally if it is gastritis, the symptoms will become better. But if they really have appendicitis, the symptom can become worsened and the pain will localize. Normally it's generalized, indigestion kind of pain, and then after that it go to around your umbilical region, your belly button. Then when it's really inflamed and when the disease progress, it start to localize where the appendix is.
So it sets in?
Sets in.
Oh my.
So when you see a doctor and you've been diagnosed with indigestion, right, but your symptoms persist, doesn't come back, it didn't go away. So you should go and see your doctor again and tell them, do you think I might have this? Right. So it can be an early symptom of appendicitis.
So aside from abdominal pain, what are the other symptoms that we should look out for?
Nausea, vomiting, their appetite is not good. Sometimes they can have dysuria, pain during micturition. Fever is quite late, but normally when the appendix start to perforate, rupture, then you can have that high-grade fever.
One of the advice that we often hear about is probably don't exercise on a full stomach. Now, could that be a cause? Is that a cause?
Exercising, exercising just after taking meal doesn't cause appendicitis.
No, it just causes you to vomit.
It just causes you vomit and indigestion. I don't think you're going to feel that good.
Alright, so what about those local myths about chili seeds and guava seeds and all sorts of weird food that they say you can't take it. If it goes into your system, you're going to get appendicitis and it's going to cause blockage and all that. How far is this?
A guava tree is going to grow.
Well, the real cause for appendicitis is unknown, but there are a lot of postulation about the cause, what might cause it. So one of it is appendicitis. Our appendix actually is the shape is like a windsock, and it has lumen inside. And when this lumen or this is being obstructed by certain things like feces, foreign bodies, included your chili seeds or guava seeds, it can cause appendicitis. So it's partially correct.
We had a question from one of the Facebook fans. For pregnant ladies, how long should they wait to have a baby if they've just undergone an appendectomy?
Sorry, come again?
For pregnant ladies, how long should they wait to have a baby if they just had a surgery to remove their appendix?
Well, appendicitis is a surgical emergency. If you just delivered and you've been diagnosed with appendicitis, you still have to go for an operation. So there's no
waiting period.
The waiting period or time frame when you should go for the operation. When you've been diagnosed with appendicitis, you should go for an operation.
So what's the side effects of not having your appendix anymore?
Actually, appendix, we've been doing a lot of research. We don't really know what's the function. So if it is out, it won't cost you anything.
All right. What about the long-term consequences of after surgery effects?
Right. It depends on your condition or when is the appendix been removed. Right. If it is just a normal acute or early appendicitis, normally you shouldn't have any problem. But the side effects, any common complication after operation is that they can have a wound infections or bleeding during the operations. But normally appendicitis is, I would say, it's like a minor to moderate procedure, so it shouldn't give problems. But let's say if the appendix been done or you're found to have appendix when it's already ruptured, there's a lot of consequences. They can develop abscesses in their tummies, they can have adhesions, they can go into a very severe condition, sepsis, if it's not removed. Right? Then let's say we have removed this appendix, or any patients who went for an operation, the long-term effect, they might have some adhesions.
What actually led to the appendix being ruptured?
Well, because of the progress of the disease. As I said, let's say after the appendix lumen been obstructed and it become inflamed, and if it is diagnosed, if it is not diagnosed early, the process will go on and it will rupture.
So some people, if they have a high tolerance of pain, they don't actually go for the checkup.
A high tolerance of pain, and let's say if the patient is like obese, a big size, they don't really feel the pain. And when they go to a hospital or when they see a junior doctor, sometimes these symptoms they won't pick it up.
So by the time they do,
it's
too late.
It's too late.
Now, Mr. Zamzuri, please tell us, how common is this actually? You see it like what, every day?
if like say I'm on call, on average you can see 1 or 2 cases
of appendicitis.
Of appendicitis every day.
Is there an increase, or
no? It's around that number.
How much does food and lifestyle play into this actually?
Well, as I said, when people talk about the myth, it's partially right, but if it is going to happen, it's going to happen. There's no way that you can prevent it.
All right, before we let you go, appendicitis and kids, when children and perhaps have to go through this situation, what's your advice to parents?
Right, for parents, for kids it's quite difficult because sometimes they can't really tell you and describe to you about the pain. So there's history mainly for the parents. So my advice to parents, if let's say they see their children is unwell, appetite is not good, they are not as active as usual.
Okay.
Right, and when they start to complain of abdominal pain and they just stay still inactive at home, you should bring to see a doctor.
How young are we talking about here?
Well, I've seen a child at the age of 2 or 3 years old to have appendicitis.
Oh, that is so sad. Whoa. Okay, so whatever it is, go for the checkup. Prevention is better than cure.
Early detection.
Yeah,
is the
early
key.
detection is very important.
Right. Thank you so much, Dr. Zamzuri. We hope
Thank you.
we've learned a lot from our short segment. I wish we can actually extend this, but we'll have you again next time on the studio.
Why not?
Thank you.